Okay.
So I think he want to.
And is he eating the special food?
Before, yes.
Okay.
And then after I don't have it anymore, so I give him something for specifically for urination issue.
Okay.
And last few days I cannot have time to buy it, so it still is a wet food. It's not dry food.
Okay, good. Yeah, he doesn't feel blocked. I'm gonna just let Dr. Claffer know he's not blocked. Okay.
So he's not. It's not blocked, right?
Not blocked.
Oh, so that's what I
know, right? So it's probably just early. They can get this inflammation, and we call it feline lower urinary tract disease. So similar to what he had last time, you're probably just catching it before it becomes a problem.
Yeah.
So what I want to do, and I think it's really important, is that he stays on that food all the time, no matter what.
Right.
So he's got to go back on that food because I think that's going to work for him. And the reason is it makes their urine a certain type of like concentration. It changes the pH of the urine and the balance of the urine so that it makes them less likely that they're going to have issues.
Yeah, because I bought another brand that I can buy, bought it in a Petco.
I know.
Which is special for, you know, for the urination issue of kitty. I don't know what it is, but last few days I just give him some normal wet food.
Yeah,
you know, so maybe that's.
And sometimes, and at some point in his life, we may be able to do that. But for now, I think he should eat this food no matter what. 11.8.
Gain weight.
Gain weight. Isn't it? And because he had a lot of crystals in his urine, from what I remember. All right, so, and I know Francesca mentioned that you were maybe thinking about keeping him here overnight.
Yeah. So I think I'm going to do this just in case.
I know. Here's the thing is that it's sometimes very, like, our goal is for him not to be stressed. And sometimes him being at the hospital is more stressful than being at home.
Because I have other cats.
I know.
I cannot. So tell me what's your treatment plan for him right now.
So this is what my plan would be if we send him home. Okay. I'd like to try and get a pee sample because I want to see what the crystal amount is like right now. Okay. You know, that'll give us a good idea as to if like he's still forming crystals to spike. Right. Give him fluids under the skin and an injection of pain medicine. And then I'm going to put him back on the capsule to relax his urethra. And send you home with more pain medicine to give him 2 to 3 times a day. That would be my plan.
You mean the pain, but the painkiller doesn't really help the situation, just make him not feel pain, right?
It does help because it helps to relax the urethra. The problem is basically they have all this inflammation going on in their bladder. And we think it's from stress, it's also from the crystals, and we're sort of trying to help that in a couple ways. So the first is the food, because it makes them drink more, so it makes them pee more, and it helps change the urine so there's not crystals. The second is the urethral sphincter relaxation medicine. That's the prazosin, the capsule. That helps relax the muscle so that the urine will flow nicely. The other component is that it is painful to have that inflammation in the bladder and painful to have the spasm. So that's why we use the Buprenex. Sometimes we use a secondary pain medicine called Onsior, which is an anti-inflammatory medicine. So it's basically like Kitty Aleve, helps just reduce inflammation, helps them not to be painful.
I want to put him here because last time, same case, I bring it home. The other day, it drive me crazy. And then I put it here because I have other cats. I cannot see what really happened to him, you know, urination or not. I'm not so sure. And because Dr. Jones is here tomorrow, and then I want her can take a look. Because I work tomorrow, so I will have anxiety.
Okay, I understand. This is so stressful. I totally know.
Very stressful.
I know. Okay, well that's fine. We'll do all the same things. I'm not going to put him on IV fluids or anything. We'll just do the fluids under the skin. Everything he would get as if he was going home.
Yes,
but we'll keep him in a quiet place with his litter box, and we'll feed him and just keep him relaxed. And then Dr. Jones can reassess in the morning. And then if she feels like he's doing fine, he can go home. If he's still having issues, then we may place the catheter. And
if he still have issue, I'd rather put him here until he is.
I understand. And then I know